Fat grafting describes any operation in which fat is used by being taken from one part of the body and put into another part of the body, or grafted into another part of the body. So it's taken often from areas such as the tummy, and it's grafted into other areas, whether it's breasts, bottoms, or elsewhere, and it's taken out using liposuction techniques. It's processed in the operating theatres, and there are a number of different ways we can process fat. And then once it's been processed and once it's been made ready for injection, it's injected in very specific ways to the recipient site in the body. And the idea is that it will take and gain a new blood supply and effectively come back to life in that part of the body where it will stay. When we take fat to graft into the breasts, we can take it from a number of places. And that really depends on the individual. Frequently we'll take it from their tummy, from the saddlebag areas of their thighs, from the flank area. Really it's determined by your body shape beforehand. Even on quite slim people we can often get some fat, but we have to consider whether you're someone who tends to burn fat easily, or you have an area of the body that fluctuates a lot with weight variations, because that may influence where we decide to take the fat from. So we've always got to think about that donor site as well as the fact that we're taking that fat to use in the breast, because the donor site is also having an operation as well as the breast, the recipient site. One of the big questions with any fat grafting operation, whether to the breasts or anywhere else, is how much of that fat is actually going to stay behind and actually be retained by the body. So we normally talk about 60% or so, and that's of course subject to variation. So some people will take more fat, so more will stay, some people a bit less. And that does vary in different people, and sometimes even varies within the same person between their first and second fat grafting operation. So that is a degree of uncertainty that we have to accept with any form of fat grafting operation. The specific risks for fat grafting, particularly to the breasts, include fat necrosis, or death of fat, and that's often if too much fat's been put in. So we've always got to use our judgment as surgeons as to knowing how much we can possibly get in without putting too much in. If there is fat necrosis, oil cysts can also occur, and these are cysts that are completely benign, that can feel a little lumpy. Any fat necrosis or oil cyst can become inflamed, and in a few cases can even become infected. And therefore we've got to be very cautious during surgery, bearing this in mind, and also act upon any inflammation that may occur after surgery. And if there's a mild bit of inflammation, normally a course of antibiotics is enough to get it to settle down. So we always hope that our patients will only need one operation for fat grafting, but it's not uncommon for some patients to come back for a second or even a third operation to get to the desired volume they'd like. And that's whether we're doing fat grafting on its own or even with a breast implant in place. There's never, I guess, a need or requirement. It's more of a desire and a wish, unless of course we're using that fat to help improve a certain contour irregularity or perhaps provide more cover to an implant. So again, going into any fat grafting operation, you have to appreciate that it might be that you are committing to more than one operation, but that degree of uncertainty is one of the factors you have to accept with any fat grafting. So one of the common questions for any operation is whether it's going to be painful. And interestingly, with fat grafting, it's more the discomfort and sometimes pain from the donor site, where we've taken the fat from, that's more troublesome than any pain in the breast where we put fat into. So considering your donor site, we make sure we give you plenty of local anaesthetic after we've done the liposuction to take the fat out. And also we've given you some supportive garments, we'll discuss those with you, and giving you some massage exercises to do after surgery to help that scar tissue settle down as quickly as possible and for you to recover from any discomfort there as quickly as possible.